Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to discuss with you ways you can self-advocate for yourself when it comes to providers, whether it is a mental health provider, whether it is a medical provider, or it is maybe a surgeon that you're trying to seek in order to get gender-affirming medical care that you do need. And before I start, let me address that in today's world, at least in the United States, trans care is definitely growing. It is definitely getting a little bit better. It's still not on par where I would like it to be and where you would like it to be, unfortunately. And some states tend to deliver much better trans care than other states. So California, for example, where I reside, tends to deliver much better and much more inclusive transgender care. There's much more bigger clinics now and hospitals that have transgender mental health services, that have transgender medical services. There's a lot more surgeons that engage and tend to tailor to trans community. Now, I also know that a lot of other places of the United States are still very much lacking in delivering very good top-notch transgender care. And that's incredibly unfortunate, and that leads to a lot of people being underserved. But that is sadly also the reality we live in today. And now I know that some people living in those states have a really difficult time finding providers that are knowledgeable or know what they're doing when it comes to transgender care. I also know that in California here, even though there's many more providers that are much more knowledgeable, it's still also a challenge as well. So how can you, as a consumer, advocate when it comes to seeking a provider? And there's actually a number of ways you can advocate for yourself, and I'd like to share them with you today, so that way it can be very helpful for you when you go and you seek a provider. So first of all, remember that even though you are going to see people that we have been taught to see as authority figures, right? Because these people have high-end degrees, these people have been working in high-end professions. You know, for example, I'm a clinical psychologist. You're gonna go see somebody who has a medical degree. You're gonna see somebody else who's gonna have another high-end degree. And as human beings, we tend to be taught to see these people as authority figures, and we tend to be taught to really take what they say as kind of authoritative truth on the matter, which is often is the case, but I'm going to challenge you to question that, and I'm going to challenge you to be able to step up and advocate for your needs and to be able to question so-called authority, because the truth is the authority is not always correct. The authority is not always right, and sometimes the authority is also learning just as much as you learning yourself. And you as a consumer today, especially more than ever, are incredibly informed, because there's so much information out there for you on the internet. Now, I get it, not all of the information is very good and not all of the information is very helpful, but there's a lot of people who are writing and putting out really good content out there, myself included. I write periodically really good, solid blog posts for you that have all really solid research information along with the videos that I make. So as a result, you as a consumer really have access to all of that information, and you become incredibly educated. Chances are you're probably putting in a lot more homework into your trans care and into understanding the procedures you're going to get, or medications you're going to get, or services you're going to get, than the providers helping you. And that is the sad truth we live in today. So if you're living in a place where you go and you see medical providers, the first thing you can do is absolutely advocate for yourself. And by advocacy, I mean being able to have your own voice. Be able not to be afraid to speak up and to say what your needs are. Sometimes people will actually print out some of my articles and bring them to medical providers, and that's totally fine and legitimate thing to do. Because guess what? I'm a professional. What you're bringing in is information from another professional that can benefit and inform your provider. So I really encourage for you even to do that. If you feel like you found some really valuable, great content out there, feel free to just print it out and bring it to your provider if you feel like your provider is lacking in that education. Don't be afraid to also ask questions. I have actually a really great blog post, I'm going to link it below, on 11 questions, key questions you can ask when looking for a gender-affirming provider. And they're really great questions to ask them, including how many trans patients have they had, what are their techniques, what is their educational background, how long have they been working in the field, and so on and so forth. All of those are made for you out there so that you can better be informed, so you can better seek out and find the providers that you need. So when it comes to advocacy, the other big step that you can do is also take your own responsibility, not just to become somebody that is going to take everything that provider going to say as a dogmatic truth, but question everything they say, do your own research, bring up your own information. And guess what? If you read something about particular anti-androgen and you really feel like it's going to be not good for you, or if you just don't want to take particular anti-androgen as part of your feminizing hormone therapy, then be able to say that and express it to your provider. You have every right as a consumer to tell your doctor you don't want to be taking particular medication. You have every right as a consumer to tell mental health provider that you have a solid sense of your mental health, of your gender dysphoria, and you have a solid sense of your identity, and you don't need to be seen for 6 months to a year in order to get diagnosis. That is a valid thing to say. You know yourself better than anybody else will know yourself better. So you have every right to tell surgeons that you don't want to get a particular procedure. Now, of course, you also have to be mindful, right? You have to listen to their expertise, but what I want you to do is also be a little bit open-minded to what you hear. Be able to discriminate. Don't just take everything as a solid truth. Be able to ask yourself questions, ask them questions. And guess what? If they're able to answer questions you ask them, then they probably know what they're talking about. If they're stumbling and they're not able to answer the questions, or if they don't even know what you're talking about, that's probably a challenge. So you could be out there in a part of the United States where there is a lack of providers, or the provider you're going to see is not really that knowledgeable. So yes, you have every right to educate them. You have every right to bring resources to them and say, hey, I read this, can we try this method? Or hey, I read this, what do you think about this? And work as a team. We have to be able to work together, because right now we're having a very big gap between providers who are not being educated enough and consumers, you all trans community, who are becoming highly educated. So there is a big gap, and we have to all work as a team in educating yourself. So the way that you can advocate for yourself is to do all of those things. Speak up for yourself. Don't be afraid to speak up. Ask questions. Don't be afraid to bring up resources, and don't be afraid to probe. Always probe your providers. Guess what? You're a consumer. One way or another, you're still paying for the services. It's an exchange of a service. Whether it's your insurance paying for it or you're paying it out of pocket, you're still paying for it, because you are paying for your insurance one way or another, whether it's to your employer or you're paying it out of your pocket. So you're still a consumer. And as such, you have a right to all of that information. You can't just, swallow everything they give you, because sometimes, like I said, a lot of times authority is not so much of an authority. A lot of times they are, but a lot of times they aren't. So you have to be able to discriminate. And the only way we're going to do that is that if you're going to ask. So hopefully this helps. Let me know, comment below, what challenges have you faced when looking for mental health provider in your area? A lot of the challenges I hear that it tends to be very common is that the provider doesn't know what the hell they're doing. And then the other challenge is that the provider is unwilling to provide transgender services. And I gotta say, if your provider doesn't know what they're doing, again, feel free to educate them. And if your provider refuses to offer you transgender services, seek another provider. It might be a challenge. You might be restricted to geographic areas. There might not be many providers, but it's better to have a provider that is maybe not so knowledgeable in transgender care, but is open to be educated, open to consult with others, open to learning from you, than have a provider that is highly educated but doesn't want to work with you, or highly educated and is pushing their envelope and is pushing what they believe is the right thing to do. So be mindful about all of that. So comment below, let me know what kind of challenges have you faced within this provider, looking for provider, trying to find provider. What is your biggest obstacles? How did you overcome those obstacles? Love to read your comments. And as always, I look forward to seeing you all next time. Bye.